before line.
Thank you, Mr Speaker. I appreciate the opportunity to speak on these bills, which provide for the legislative mechanism to additional measures in the government's 2025-26 budget. Commonwealth expenditure is a significant issue for the Line electorate, more so than ever, with a lack of funding flowing to regional Australia, including the mid-north coast of New South Wales. Increasingly, and certainly following the devastating floods of last year, constituents throughout Line are feeling that we as an electorate, as a non-government seat, though having to deal with the consequences of the government's poor fiscal discipline, including high inflation and a cost-of-living crisis, are not getting our fair share of the funds. And this is in spite of my concerted efforts for genuine engagement and collaboration with the ministers and the government, and the many proposals that I put forward for funding during the election and since, where my Labor opponent, and in fact no other opponent, matched or even put forward one project for funding. I've heard over this last fortnight many times the government's claim that it is a good friend of regional Australia, and I wish it was so. But the statistics paint a very different picture. Throughout their first term of government, Labor cancelled, cut and delayed more than $30 billion worth of infrastructure projects across the country. They abolished regional infrastructure programs, including the Building Better Regions Fund, Community Development Grants, Stronger Communities program, the very well-supported Local Roads and Community Infrastructure program, the Roads of National Importance, the Bridges Renewal program, the Regional Accelerator program, the Regionalisation Fund and the Energy Security and Regional Development Fund. Each of these programs were vital sources of funding, particularly for regional councils, to undertake both transport and community infrastructure upgrades. Even most of the regional and community infrastructure programs established by the government in its first term, such as the Growing Regions program and Thriving Suburbs program, have ceased. Now, I'm not prepared to leave it to the government to come up with the solutions. And since I was elected, I've been working with my electorate on their priorities for funding, to the extent that I have drafted and submitted a pre-budget submission to Treasury, to the government, to highlight our funding priorities and opportunities for budget reform across multiple portfolios in areas of need, including health, aged care, education, housing, water security, transport infrastructure, emergency recovery and preparation, community and sporting infrastructure and telecommunications. The submission was developed through consultation and public call for projects, and I sincerely thank my community for its response and engagement. Individuals, progress associations, sporting groups and councils have all been party to the document that I sent to Treasury on the 29th of January. In that document, I call on the Albanese government to reform its funding profile to regional Australia, to dedicate more funding to address the disadvantage and give due consideration to the Line electorate's needs. And I'll echo some of those needs here today. Health, as many of you well know, is one of the major concerns on my mind and on the mind of Line residents. And I'm very concerned about the level of access to health services across the electorate. It is clear that we need more investment by both the federal and state governments in local health services. While successive Labor MPs get up in this chamber and speak of the urgent care clinics that have just opened in their electorate, non-government MPs cannot say the same. Of the 122 open clinics, 88 or 72% appear to be located in Labor electorates. Just 2% are open in national seats. In New South Wales, 24 exist in Labor seats. Just three are in Liberal seats and 2 in national seats. The Minister for Health, indeed most members in this chamber, are certainly well aware of my efforts and my determination to secure an urgent care clinic for Taree. And whilst there is plenty of friendly banter at times across the chamber on this issue, its delivery is serious and urgent. Today, I was looking on my social media on a post that I put up around the urgent care clinics debate earlier this week in the chamber, and the response was from one of my constituents was, "Labor seems to be having a laugh at us." That's how the people of Lyne are feeling about the response to the call to an urgent care clinic. And the only difference between members on the other side of the chamber and the Lyne electorate is that Labor did not promise an urgent care clinic in Lyne at the federal election. I was the one who promised an urgent care clinic, one that would have been delivered if we had got into government. So the only difference is, it seems to the people of the Lyne electorate, is because we're not a Labor seat, that we don't get one. Now, how does that meet the Prime Minister's commitment to govern for all Australians? How does it meet that commitment? It doesn't, and it doesn't pass the pub test for the people in the Lyne electorate. We have the oldest demographic in the country. The obvious negative implications of having an elderly population on the electorate's healthcare infrastructure is compounded by severe low socio-economic markers, which exist throughout large swathes of the electorate, particularly within the township of Taree and the wider Manning. Indeed, in 2016, the CEFA Index of Relative Socio-Economic Disadvantage score for the Mid-North Coast LGA was 943, well below the Australian average of 1,000. In 2021, there were 108.9 GPs per 100,000 population. Again, this is well below the New South Wales average of 123.8. Insufficient numbers of GPs, coupled with socio-economic fabric of the region, means that an alarming and increasing number of people are either unable to source a GP or cannot afford to see one. As a result, the area is experiencing sustained growth in ED demand. The Manning-based hospital, the region's only public hospital, is seeing a substantive volume of semi-urgent and non-urgent triage 4 and 5 presentations that are appropriate for an urgent care pathway. For instance, between the 1st of October 2024 and the 30th of September 2025, and these are figures I have provided to the Health Minister, the Manning-based hospital saw 12,429 triage 4 patients and 4,698 triage 5 patients. That's 17,127 low acuity presentations annually. Redirecting suitable triage 4 and 5 presentations to an urgent care clinic would relieve pressure on the ED, free ED treatment spaces and clinician time for higher acuity presentations, reduce overall waiting times and the proportions of patients staying greater than 4 hours, reduce ambulance offload delays by clearing ED capacity and reducing bottlenecks, improve patient experience with faster treatment for low acuity problems with an urgent care clinic model and less time in ED waiting rooms, and make better use of workforce. Redirecting even just 30 to 50% of those annual presentations would remove 5,000 to 8,500 presentations per year from the ED, delivering noticeable improvements in ED capacity and wait times. I note that an urgent care clinic was committed to in Maitland and has been delivered, a commitment I also made and a commitment that I have welcomed, because it will benefit many of the constituents in the southern part of the Lyne electorate. And I'm grateful and I thank the government for delivering on this commitment. But Maitland is almost 2 hours away for constituents in Taree. And whilst I acknowledge that through the New South Wales Government and the determined efforts of my colleague, the member for Mole Lakes, Tanya Thompson MP, that the New South Wales State Government has committed funding, but yet to be delivered, to an urgent care clinic in Foster Tuncurry, this is not enough to adequately serve the health needs of residents in Taree, in the Manning Valley and in the Great Lakes region. Now, I want to take a moment, because earlier in this debate, a member from the other side talked about cuts, talked about how the coalition cuts funding. Indeed, I think cuts is used by the other side as well, and certainly by Labor, because the New South Wales State Labor government cut funding when they came into government for a Foster hospital, for a public hospital in Foster. That is Labor, and that is how it cuts. Let's not forget that. So, Deputy Speaker, I have asked the government, I have written to the minister 3 times. Indeed, the minister has never personally written back to me in those 3 letters. I've had 2 responses from the Chief of Staff, and having been a Chief of Staff to a Cabinet Minister, we never wrote to opposition members. I would have never written to opposition members as the Chief of Staff. It was always the Minister that wrote. But indeed, I've written 3 times, and I haven't yet had a response to the Minister. And the other day, I have to work harder for one. I have to work harder because I'm on this side, yet Labor did not commit to an urgent care clinic. I did. I'm supporting a policy that many members from the Labor side have come up to me and spoken about, telling me about the benefits it's bringing to their communities. I'm supporting it, yet I cannot get a response from the Minister. So the battle goes on. There are many, many other issues that I could speak to, but I will, in the time remaining. I want to talk about the floods and the flood recovery on the mid-north coast. Indeed, it has to be one of the most traumatic events that I have experienced in my time, and the trauma continues. Only last week I was in a town called Wingham, which is only 10 or so k's from west of Taree, a community that's situated on the Manning River, and a community that is living the legacy impact of the floods now all these months later. A town that continues to be cut off from others like Tanoni, Cranback, because the Bight Bridge that was completely smashed by the floodwaters continues there's no work being done on it. It's a big job. It's a big job to rebuild that bridge. It does need engineering expertise, but the community is frustrated that they're not seeing any action at all. There's the Tyree Bridge, which is a bit further out in a more remote part of the area. Thankfully, and I'm grateful, I've seen a message this week that there will be a temporary bridge put there which will help residents out in that area. But the Bight Bridge in particular, the impact is that the business community of Wingham is suffering significantly because a large population, it takes an hour and a half now. It takes an hour and a half for people that used to be able to go 10 minutes, bring their kids to school, go to the pharmacy, go to the local Coles. It's an hour and a half to come round to Wingham. For people that work in Wingham, it's an hour and a half. A lot of the business now has shifted to Taree and to Foster and to other areas. It's a huge, significant issue, and the community is incredibly frustrated. They're also frustrated because, as I can see under the disaster funding recovery arrangements, the Wingham pool is not considered an essential piece of public infrastructure. Now, to the people of Wingham, I can tell you, particularly in summer, it's an absolutely essential piece of public infrastructure. The pool was impacted by the floods. The council's decided it cannot be rebuilt where it is. They're going to need to find another location, but there's no guarantee on funding, and that is an enormous issue. The other concern that I have in relation not only to Wingham but across the area is the Mid-Coast Council, which is the council covering the Taree area. They've estimated that the cost of the recovery is $226.5 million. They so far have expended $43 million in recovery. How much have they got from the disaster recovery funding arrangement? Any guess? $3 million. Is that all? $3 million is all that they have been reimbursed under the disaster recovery funding arrangements. Now, this is a huge impact. Indeed, I'm on a committee that's looking at local government financial sustainability. Here's a case in point. $3 million when they've got $226.5 million. So I'm disappointed in the the pace of the support for my councils, and I'll be looking to government to stepping up across all funding support. Thank you.